Tuberculosis. It's a disease that's been with us for literally thousands of years. You'd think we'd have it totally beat by now, right? But it's still this huge public health challenge all over the world. So today, we're going to use the fight against this ancient disease as a case study to see exactly how modern public health works. It's a fascinating story. Let's get into it. So that brings us to the big question right up front. With all of our incredible medical advancements, why on earth is tuberculosis, or TB, still a top priority for health organizations around the globe? The answer, it turns out, tells us a lot about how these diseases stick around and how we've gotten smarter about fighting them. All right, so here's our game plan. First, we're going to unpack just how big of a problem TB still is. Then, we'll dive into the three main strategies we use to fight it: prevention, detection, and treatment. And finally, we'll see how it all comes together in this massive, ongoing battle.
To really get the strategy, you first have to understand the opponent. And trust me, TB isn't some dusty disease from a history book. It is a persistent, widespread, and really challenging foe. And this right here really proves the point. If you look at the UN Sustainable Development Goals, these are the huge global targets for a better world. Tuberculosis is listed right there. It's in the same category as HIV and malaria. That tells you this isn't a forgotten disease. It is absolutely a frontline battle for global health today.
Now, if you want to know why TB is so stubborn, these two words are key: prevalence and incidence. Let's break it down. Think of a coffee shop. Incidence is the number of new people walking in the door every hour. Prevalence is the total number of people inside the coffee shop at any given moment. With TB, new cases, the incidence, keep popping up. But the treatment can take a really long time, so people stay in the shop for months, sometimes years. And that means the total number of cases, the prevalence, stays incredibly high. So how do you even begin to fight a disease like that? Well, the first and most important strategy is to just stop people from getting sick in the first place. That's where prevention comes in. It's our first shield.
And the absolute cornerstone of TB prevention is the BCG vaccine. Now, this is what's called a live attenuated vaccine. That basically means it uses a super weakened but still living version of a related bug to teach your immune system how to fight without actually making you sick. For over 100 years, this vaccine has been a key weapon, especially for protecting infants from the most severe forms of TB. But, we have to look at the whole picture. The BCG vaccine is overwhelmingly safe and effective, but like any medicine, it's not 100% risk-free. There are some very, very rare adverse reactions that can happen. And this is a classic public health calculation, right? You have to weigh these tiny risks against the massive benefit of protecting millions of people from a truly terrible disease. Okay, but vaccination alone isn't going to cut it. What about all the people who might be infected but have no idea? That's where the second part of our strategy comes in. We have to actively go out and find those hidden cases, and we do that through screening. The key thing to understand about screening is that it's not for people who are already feeling sick. It's a proactive hunt. It's about searching for a disease in people who feel perfectly fine. Think of it like being a detective, looking for clues before a crime has even been reported. And this is absolutely essential in the fight against TB. Actively screening for TB is one of the most powerful tools we have. By finding these hidden cases early, we can get people treated and, crucially, stop them from unknowingly spreading the disease to others in their community.
All right, so we've prevented a bunch of cases with vaccines, and we've found the hidden ones with screening. Now what? How do we actually treat them effectively? This is where the story takes a really revolutionary turn.
This quote you're looking at, it was a total game changer. For decades, the standard was to take people with TB and isolate them, often for months, in these expensive hospitals called sanatoriums. But then, a groundbreaking study in India decided to test that idea. And what they found was incredible. Treating patients at home, what they call domiciliary treatment, was just as effective as locking them away.
And that one discovery completely changed the playbook. Suddenly, treatment became more accessible, way more affordable, and much easier to scale up. It's this simple idea that led to incredibly effective global strategies like DOTS. That's Directly Observed Treatment, short course. It's a system where health workers can support patients right in their own communities, making sure they complete the long course of antibiotics they need to be cured. So let's just take a step back and pull all of these pieces together and see the big picture of how public health wages this war against tuberculosis.
See, it's not about one magic bullet. It's a smart, three-part system that works together. First, you prevent what you can with vaccines. Second, you detect what you couldn't prevent by actively screening. And third, you treat what you detect with strategies that actually work for people in their real lives. Each part is critical.
And that kind of leaves us with one last big thought. We have the science, we have the tools, we know how to prevent, find, and treat this disease. So the question that remains isn't purely medical anymore. What do you think is the biggest hurdle left to ending TB for good? Is it about money, logistics? Is it about fighting poverty and inequality, or something else entirely? A lot to think about there.